Good afternoon, class. Today I'm going to be doing a demonstrative speech on how to put a cast on. Miranda has volunteered to be my Vanna. Here's her beautiful arm. The reason why I chose to do this is because it's something that I feel comfortable with and I feel I can be able to properly deliver the information well. The goal of putting a short arm cast is to immobilize the wrist. As I talked about last week in my PowerPoint and my speech, I spoke about radius fractures. So today we're going to be casting a arm which would immobilize a radius fracture to allow it to heal. So this was what I was talking about. This is our radius fracture. You can see that here, as well as another view would be right in there, and this is the lateral view, which would be like this position. If you, over here, I'll show you some of the materials that we're going to be using. This is a stockinette that's going to go directly onto the patient's arm, and then a little thumb stockinette. I'll show you in just a moment what we'll do with that. This is 2-inch web roll. This is just cotton that goes on top of the stockinette, and then we have cast tape as well. Miranda chose green today. Got some gloves. This stuff gets pretty sticky, and we have some scissors as well to manipulate through the hand of the arm. Okay. So generally with positioning of a patient, you want to do it in the most position of comfort. Miranda is already displayed in a position of comfort. Generally is a neutral position, as well as I can see both the the inside and the outside of the arm so that I'm able to maneuver around. You're going to want the patient to go ahead and remove your ring, remove any bracelets, anything like that. Generally they don't have anything on, but if they do, you're going to want to have a nice clean arm that has nothing on it. So we are going to start with our stockinette. Your whole hand is going to be in here. Some landmarks to pay attention to are going to be that you're going to want to extend the stockinette a bit above the finger. So I'm going to cut just a bit off. Make a fist with your hand. Okay, and then I'm going to cut a spot for her thumb. That way I can see the end of her thumb. I can actually see the palmar crease where the cast is going to end. And then I'm going to extend the stockinette to about 2 inches to the end of the elbow where I'm actually going to roll back the material at some point. Okay, then we're going to create a little thumb sock. Okay, and we're going to start with some 2-inch web roll. Again, you're going to start at the wrist and you're going to work your way around and up the hand with 50% of the material covered. So I don't know if you can see, about 50% here as well as here is covered. And then I'm going to start with 100% going down the arm. So that here's the 50 and the 50, and then when I come back, you'll see that I'm coming back 100%. So that technically we have 3 layers of padding covered on the arm. Now you don't want too much padding, because then it will actually interfere with the healing process. And if you have too little padding, it'll interfere with taking off the cast, which could cause a burn to a patient, and you definitely don't want to do that. Now I'm going to put on my gloves for the sticky stuff. And again, I just kind of layered up and padded up around the thumb as well as the bottom of the arm, just for extra padding and comfort for the patient. Go ahead and get your cast material wet. Kind of drain it a little. And then again, start at the wrist. And if you can see, I'm kind of just laying down the material instead of pulling or tugging. And that's going to help with circulation issues, to ward off circulation issues. If you put a cast on too tight, it will be very uncomfortable and the compliance of the patient will be less. And again, I'm just laying the material down. I'm not allowing for any bumps to occur. You want it nice and flush with the skin. And then we kind of just rub it down to make sure all the layers are kind of adhesed together. And I pull down this stockinette here, for our nice, pretty borders. And last roll. Generally, it only takes about 2 for an arm, and then you can see these are actual 2-inch materials. Sometimes with a kiddo, you can get away with 2-inch most of the time, but sometimes you have to use a 3-inch material just to extend a little bit more coverage of the arm. And then with legs, you're always going to use 3-inch, but today we're doing a short arm cast. Okay, throw away, whoops, my extra material. And generally, again, just rub down all the materials and make sure that they all kind of adhere together. I'm going to go ahead and have Miranda relax her hand, and as you can see, it rests right here in the palmar crease of her hand so that she's still able to use and grip things with her fingers, and maybe even pick up things with her arm. So my objective was to make sure that I put on a symmetrical cast with appropriate padding. A couple things that can occur with too much padding, like I said earlier, would be we could lose reductions or lose positioning of the bone. And with too little cast, we could actually hurt and burn somebody if there's not proper padding inside the cast. With bunching of the cast, like I showed you with the twist earlier, if that is directly up against the skin, the patient could get a pressure sore, and that would also be something that we really wouldn't want to do. Sometimes those pressure sores require antibiotics and extra casting. Okay. I'm just applying a little bit of interosseous mold, which that means is in between the bones. And if you see here on this AP view, in between the bones is considered interosseous. So that also just helps kind of keep the cast in position. And that's it. The cast sometimes takes about 8 to 10 minutes to dry. It is sticky. Generally, that's why we use the gloves, but after about 3 or 4 minutes, it's not sticky anymore. And if you take a look, you want to demonstrate, we have a nice I can't ever say that word. Symmetrical cast with a good palmar crease to allow for function, and it's properly padded on the inside. Hopefully our patient will be compliant in the cast. All right, I hope you enjoyed my demonstration today, guys, and I can't wait to see yours. Have a good rest of your day, and happy Turkey Day.